Hi, thank you for participating in the ACP Wellness Wave. My name is Eric, and I'm a medical student at UC Davis School of Medicine, representing the Northern California ACP chapter. Today, I'm honored to interview Dr. Aronowitz. So, Dr. Aronowitz, can you be so kind as to tell our ACP viewers a little bit about yourself and what you do?
Yeah, sure. I originally am a graduate of Case Western Reserve School of Medicine in Cleveland, Ohio, and did my residency at UCSF in internal medicine and a chief residency there. Was on faculty for a couple of years there, and then left and became one of the first hospitalists in the United States at CPMC in San Francisco. Subsequently became program director there for 11 years, and then was fortunate enough to be recruited to UC Davis in 2012, where I've been the clerkship director of the internal medicine clerkship ever since then. I do a bunch of other things within the medical school and the internal medicine residency program.
And how did you choose your career path?
Yeah, I think in those days, about 50% of the graduating class at Case went into internal medicine. So it was one of those things where I liked just about everything except for OBGYN. I didn't enjoy that as much as some of the other rotations. I loved pediatrics. I loved surgery. And I liked psychiatry a lot too. But I turned around and looked at my class, and most people were going into internal medicine. So I was like, well, if it's good enough for them, it's good enough for me. And there was a lot of things that I found really fun about medicine, because you do spend more time talking to your patients than in some other specialties. Not as much as psychiatry, but more than, like, say, surgery or something like that.
Yeah. And what advice do you have for rising medical students and current residents as they're figuring out their path in medicine?
Boy, well, I think, like, the favorite line people use is "find your passion." Sort of like my wife and I were watching Soul, the Pixar Disney movie the other night. It's all about, like, finding your spark. But then they sort of realize at the end that it's not about the spark, not to ruin it for anyone. It's more about enjoying life and appreciating it. And I think that you want to try and find what really gets you up in the morning and keeps you going, and figure out, I think to do that, you have to figure out what it is that you enjoy in life. Like, whether it's just spending time with people, connecting, or something else, research or the science part of medicine. And I think that will help, excuse me, guide you towards the road you want to go down.
Mm-hmm. And so, speaking of enjoying life, I think a really important topic nowadays is physician wellness. So, what is your strategy to sort of prevent burnout and deal with a lot of the stressors that come with the day-to-day of being an internist?
Yeah, I guess I would take this opportunity to recommend a podcast. It's one of I think it's actually through the ACP. Oh, Reset is the name of it. A friend of mine who was interviewed on it recently, Daisy Smith, who's pretty high up at the ACP. And it's really all about changing gears in your career and being prepared for that. And sometimes those changes come out of burnout, like where you just burn out on doing one thing and really need to pivot and do something else. But I have to say that, like, you don't always want to have to be changing completely what you're doing to stay in medicine. So I think a lot of it is strategies to continue enjoying what you're doing. For me, that's often been about getting outdoors. I like to trail run. And I think that that's a tough thing to do if you're in, say, North Dakota in the wintertime.
Yeah.
But if you're, but you still have to find some way to get out there and just sort of have a release from the stresses and strains of medicine. Because no matter what field any student chooses to go into that's watching this video, you're still going to have those stresses. And I think that if you find a out of medicine strategy, is baking croissants, which I also enjoy doing, or trail running, I think it's kind of making sure you go back to those things periodically, as well as continuing to develop new interests and hobbies outside of medicine, which is easier said than done, but important.
Absolutely. Well, thank you so much for sharing your knowledge with us. Our viewers will most definitely benefit from the advice you shared.
Well, thank you, Eric. Thanks for having me on.
Of course. Thank you.